A very good afternoon and welcome to the session on a very important topic today, which is fibroids busting the myths. We welcome the doctor for the day, which is Dr. Anuradha Panda from Apollo Cradle and Children's Hospital, Jubilee Hills. We welcome you, ma'am. I would like my audience to know that today's topic is very important, and if you have any doubts related to the topic or you want to ask our doctor anything, any related to, uh, any gynecology, obstetricians, and any doubts you have from the doctor, you can just ask her in the comment section,
This is not
and
very
we'll
useful
be
now.
taking the
Because,
questions by the last of the session so that we
sound is not
get
good,
through
right?
the important details
No. Actually,
and
we have
stay
to
tuned till the
cover
last so that you don't miss out on any
cable
part
is
and details the doctor has to share. Doctor,
discuss.
you have the stage now.
Okay, can I start? Hello, everyone. I'm Dr. Anuradha Panda from Apollo Jubilee Hills Cradle and Apollo Health City. And now I'm going to discuss on fibroids busting the myth. As you all know, fibroids is a very common tumor in a woman. I was going through literature, you'll find around 25 to 35% of Indian women may have fibroids. But most of the time, this is what we know when we do a scan or a patient comes to us with complaint. But more often than not, we have many women who have fibroids, we don't even know about it. So, so I thought busting the myth would be a good topic because whenever you have a fibroid, whenever somebody sees a fibroid in ultrasound, they come running to the doctor. There's a fibroid. What is to be done? So let's first say, first thing they'll ask, is the fibroid cancerous? It is not. Okay, a fibroid is not a cancer. What's a fibroid? Is a benign tumor arising from the lining of from the uterine wall. There's a myometrium. The uterus, as you know, the inside there's a lining called endometrium. The lining which is shed every month, there's endometrium. The middle layer, we can't project things. That's why it's a problem. So the center is the wall which has muscle tissue, and there's a myometrium, and beyond that is the serosa, is the lining. So what happens is the fibroids are tumors from the myometrium. So fibroids are benign tumor. They are not cancerous. uh, what would you say? They grow slowly depending on your hormones, on your estrogen, on your progesterone. They need a hormonal milieu. That's why after menopause, many of the times we fibroids which are there will continue, but we don't have new fibroids then. Okay. So the next thing is whenever there's a something called a sarcoma, which is a cancer of the what will you say? It's a cancer in the uterine fibroid, but per se, what fibroid you have doesn't change into cancer. A sarcoma is a de novo occurrence. It comes out separately, which looks different, which works different, and it grows very fast. But whenever you have a fibroid, which is a benign tumor, the rate of growth is very slow. Over 1 year, you may find 1 or 2 centimeter increase in growth. A fibroid shouldn't be growing very fast. The second is people come and ask, can I get pregnant with a fibroid? Will fibroid cause infertility? Not all fibroids cause infertility. Infertility, I would say it's not infertility. There may be a difficulty in conceiving in some people if the fibroid is located inside submucosally. When it is pushing into the uterine cavity, that time you may have little difficulty in conceiving, or there may be chance of abortion. But if a fibroid is outside, subserosal fibroid, it may be very big, but you don't even know and you are pregnant. So all fibroids do not cause infertility. Depending on the location, there may be chances that you may have difficulty in conceiving, but it can always be removed and you can always get pregnant. So a submucosal fibroid or a fibroid which is near the tubes, you have the uterus and the tubes. If there's a fibroid growing there, blocking the tubes, causing pressure on the tubes, then maybe there may be little difficulty. If it's on one side, no. On both sides, which is rare. Okay. Then other thing is all fibroids have to be operated. That's again a myth. You have lots of fibroids which are small. You have something like seedling fibroids, some millimeter. If it's more than 5 centimeter, most of the time, if it's growing big or it is causing pressure symptoms, we may ask you to be operated. Now, you have seedling fibroid, very small, 1 centimeter, 2 centimeters, sometimes a little bigger, 2 centimeter, 3 centimeter. They are inside the wall. If you have no symptoms, you don't need to get operated. If it's outside, it's causing pressure. It is very big, 10, 12. Sometimes we come with people come with fibroids 15 centimeter, 16 centimeter with big mass in the uterus. If they are causing symptoms, a symptomatic fibroid will need to be operated. All fibroids do not need surgery. That is important. And again, the location of the fibroid, and if they are causing any side effects, we will ask some people to get operated. If it causes pressure symptoms, it's pressing on your bladder, you have the urge to urinate more frequently, or it is pressing on the bladder and back pressure on the kidney and it's causing the, what will you say, swelling or the dilatation of the ureter, hydronephrosis, what we cause, then we may ask you to get the fibroid removed. Okay, so the other myth is also busted that all fibroids need surgery. Number four, I would say, is recurrence. Well, fibroids do recur. So many women who are more than 40, 45, they have multiple fibroids. We sometimes say to remove the uterus rather than removing the fibroid. Because even if you remove one fibroid, if you have a tendency, fibroids may grow. There are some women, like in African origin, they have lots of fibroids. Sometimes you have 20, 25 fibroids removed from a woman. In the Indian scenario also, we have people who have fibroids, maybe 5, 6, 7, 8 fibroids, and sometimes the whole uterus may be replaced by fibroids. If you have multiple fibroids and you are older than 40, the childbearing is complete, then your doctor may advise for a hysterectomy. But all fibroids need uterus removal, that's also a myth. You can always go for a myomectomy. Myomectomy is removing only the fibroid, and this can be done when depending on location. It can be done laparoscopically, it can be done robotically. You can even use a hysteroscope. If the fibroid is inside the uterine cavity, it's in the endometrial cavity, it's a fibroid polyp, or it's pushing into the cavity, those can be removed by a non-invasive method called hysteroscopy. You put a camera inside the uterus, see that, and resect it out. We resect it out in piecemeal, and remove the fibroid. If it is on inside the wall or outside or in the wall and going out, those can be removed by laparoscopy or robotic. Robotic has an additional advantage that when you remove it, we remove it very nicely. I mean, what will you say? We cut the fibers and remove. We are careful in causing least injury, and it is always easier to suture the fibroid in layers. When you have a big fibroid, when you remove that fibroid, you have a big gap. So that gap has to be closed nicely. So robotic helps us in closing. Not that you can't do it laparoscopically, but sometimes robotic has an edge. And when you have multiple fibroids in difficult position, then a robotic helps you either in removing the fibroid or in removing the uterus. Then what we will next would be all, I said hysterectomy is the only treatment option for a fibroid. No, you can always go for a myomectomy. If need be, your doctor will advise for a hysterectomy in what situations I have told you. The other thing is fibroids will vanish once I get menopausal. We have women coming to us with 10 centimeter, 12 centimeter, 15 centimeter fibroid. They'll say I'm 48. Now all this fibroid will shrink the moment I get menopause. It is not so. Once you get menopause, your hormones will come down, estrogen, progesterone. The fibroid may not grow more, or may not grow, but it doesn't shrink immediately. And a 10 centimeter fibroid cannot become 2 centimeter even if you are menopausal. If the fibroid is causing symptoms for you, you may have to get treated. Then there are some non-invasive methods. People come and ask, any medicine for the fibroid? Well, when you have medicine, for example, we have some injection, GnRH, we give them, but moment the fibroids may shrink when you give the injection, but the moment you stop the injection, the fibroid may again increase in size. So it is a temporary thing. And then we had other medications for the fibroid to reduce it, but those medication, other side effects, like they had effect on the liver. So when it's really necessary, or somebody is just wanting a pregnancy, very small fibroid, the doctor may decide whether to give you that medicine or not. That you have to consult your doctor and find out. Some people even ask you, there is some other treatment for fibroid which is not surgery. Like we had a high frequency ultrasound which was MRI guided, but that sometimes reduces the size of the fibroid. With very big fibroid, it may not reduce everything. So it depends on case to case basis. that is there. And something like uterine artery embolization, when you embolize the vessels, you cut off the blood supply, the fibroid gets necrosed. But that also has some side effect. When somebody is going and doing that, they should consult the doctor, they know the side effects, and then go ahead with it. So if any other thing which is a myth, all fibroids are symptomatic. All fibroids will cause symptoms. That is another myth. People will say, I have a small fibroid that is causing symptom. Anything happening in the pelvic, in the pelvis or in the lower abdomen, they attribute it to fibroid, but it is not. Many times you may go do that, remove the fibroid, remove the uterus, but your symptoms will be there. So whenever necessary and indicated, we should know whether the fibroid is really causing those symptoms before we decide to do operation. That's very important. And but because all fibroids are not symptomatic, you may have fibroids, you may not even know. You must be having the fibroid when you were 30, and you may detect it even at 50 when you're doing ultrasound for something else. So symptomatic fibroids, what are the symptoms of fibroids now? Now the symptoms, most important is a heavy bleeding, and some people have pain. Sometimes it is inside the cavity, or then it is painful. Sometimes when it many fibroids in the wall during the periods, it may be painful because the uterus cannot contract on the fibroids properly. So there is heavy bleeding, there is pain. And sometimes fibroid in difficult location. You have some patients coming with difficulty in passing, or suddenly their fibroid, their urination has stopped. That is because of a cervical fibroid. The fibroid is lower down in the cervical canal. So the location of the fibroid will decide your symptoms. And sometimes a patient may not know the tummy is enlarging, and she has huge fibroids. So those may be just asymptomatic fibroids, but you detect when you put a hand on that, you find a big mass, and then we send for ultrasound and we find that she has a fibroid. So all fibroids are not symptomatic. Many people don't even know they have a fibroid, because many women by the age of 30, as I said, it may be 30-35% women may have fibroids. But every time people may not have symptoms, it may not be known. So the bottom line, I would say, don't get panicky because you have a fibroid. All fibroids don't have symptoms. All fibroids may not cause problems for you. You have to see your doctor. She would be the best judge to tell you. And sometimes when you think there's a fibroid, I have to remove it, everything will be better after that. No. So if the fibroid doesn't cause symptoms, you may not get better even after removing it. So we have to all decide, see what it is, and all of you will know there's a benign tumor, it is not a cancer. And some the symptoms will depend on the location of the fibroid, and that will again decide your mode of treatment or not taking any treatment. Thank you. I think I am open to any question. You can make it interactive. If you have any questions, please ask me.